So, any thoughts on what Joe's been talking about?
Hi Joe,
Hi, Leah.
I'm Selena Wallace. I'm the PPI lead for Art North West Coast. So I'm happy to chat with you at any point about our experiences of working with our public advisors during COVID. Just wanted to say it was sounds like an interesting project. I did low carb myself a number of years ago and found it very successful, and I'm planning on going back to it at some point. And I also worked with a woman who controlled her type 2 early onset type 2 diabetes using it during pregnancy. So yeah.
So, did you see, Joe, there was a systematic review in the BMJ last week?
One that it's come out as further, because there's a paper in Nature as well showing further examples that it's working better.
So this looked at low carb and extreme low carb. We're looking more towards the extreme end, aren't we? But yes, it did show a significant benefit, and in both in terms of medication and in terms of people coming out of having diabetes, but that was a lesser effect.
Yeah, so the way that the program is planned to be structured is not necessarily to prescribe a level of low carb, but to work with people to what they can sustainably manage, but with a general emphasis on trying to get as low carb as possible, because that is what the evidence shows, a clear gradient of outcome towards how much carb you can reduce.
You said it's already been running the program for quite a while. Has anything been published about outcomes so far?
So this is heavily influenced by what the Unwins have done in Southport. So they've published their evidence, which was from, I think, with the main paper that they did was like 4 years worth of evidence, and showing that 50%, so it was like 70 people went into complete remission and maintained it for 4 years overall, with really good benefits. The issue with that paper was it's quite small, but also they didn't publish health inequalities and demographic data, and obviously we can presume that the population at Southport was significantly more affluent than it would be in central Liverpool. So I think I'm particularly interested in the kind of digital aspect of it, because obviously there's a lot of digital poverty, but then there is also the idea of doing things over Zoom and using smartphones and things does also make it easier for people to not have to commit to going to a place, and if they've got childcare and other demands on, might make it easier. But I don't know if anyone's knows of any schemes that have used similar things, or has thoughts on it from experience in Liverpool.
Can I just check with you whether you mean the tech side of trying to get public involvement in the study, or about recruiting people and the way that you use the interventions? Are you talking about using the interventions?
Yeah, so the actual delivery would be Zoom or equivalent, and I suppose my concern is that provides, but it's likely to be an extra barrier. But I think there's probably different groups that I've done some outreach. Done some outreach with. Go on, Mark.
So traditionally, we'd have gone into a community hall and run the group there, and people would have come along at a set time, that have met the health trainer, that have done that day's work, information sharing and everything else. But this is about to what extent people's experiences of not being able to do that because of social distancing and staying at home, and whether or not people had experience of how well virtual community meetings have been working with the health focus. Have I got that? I think I've got that right, Joe.
Yeah.
I don't have experience of it, but I've heard someone presenting on it, and it was before the pandemic. They were running an arts project.
Mm.
They didn't have the money to provide it face to face everywhere, so they did some of it online, and they were really surprised to find it worked as well as it did face to face. They got just as good feedback from it and just as good outcomes from it. So it's yeah, I'd say just don't assume it's not going to work, because
No.
yeah.
I'd be interested in people's views about motivation in a remote meeting and maintaining momentum towards a common goal.
But I run a help run a emotional coping group for South Sefton neighbourhoods, and because of COVID, we've been online. We have a 10-week course, and it's once a week. And at first, we thought a lot of people will drop out because of the technology part of it, but a lot of people enjoy that part of it. They feel like they're a bit more anonymous type of thing. You'd rather have it like that. It's strange. Some people don't like it, and some people do like it. But what I would say to you is that it is all about social inadequacies, because a lot of people just haven't got broadband, free Wi-Fi. This is your problem. People sign up for these things, and when they realise an hour on their phone costs so much of data, they quickly drop out,
Yeah.
But again, this is at the moment, it's the only thing we've got, isn't it? So
yeah, I think as well, just on that point, the problem with this as well, we wouldn't want anonymity, we want people to be engaged, but
yeah. Well, when I say engaged, I think it's at their terms on Zoom. A lot of it, it's people. Again, it can be a help, because people don't have to have bus fares and mobility problems, and especially if you've got diabetes, maybe that might be part of your problem as well. So it might be good to be from Zoom, but problem is a lot of people do not have access to especially laptops as well. If you're going to get a Zoom meeting properly, and with interactive things, you need a laptop. A phone's not really viable, is it? I was on a phone before, and it's not very good at all.
Yeah. Okay, I think we're
when you cost in some kind of internet access cards into the intervention, maybe.
Yeah,
that would be like a fob thing, which they do, like what they do for the homeschooling now. They've only just realised now to start doing it.
Great, that was actually really helpful. I think our counter from Debbie went quite a while ago. I think we're being summoned back.
Oh God.
No, we're swapping. It's midway.
Oh, we're all right. You can stay if you want, can't you?
So we're in part 2. So you'll have more people joining.
But yeah, I think.
So a quick summary of where you're up to, Joe, for the people who are joining, and then take it forward from there.
Yeah, so we were just discussing around the kind of tech poverty side of things, and concerns about how to get people involved, and whether fully contributing to a group is possible over a phone, and then also what type of tech poverty that Alan was talking about. The good point that a lot of people don't have enough broadband, or like the cost of broadband for an hour a week, it's quite significant, and whether we could look at getting some kind of like refund card thing to be able to access it. Sorry, Alan, I kind of cut you off. And
no, you're quite right. It as a side thing, because you can't really get robust evidence, again, because you don't know how many people are going to it because it's good, or because how many people are dropping out because they haven't got the internet access.
Yeah, I'd be keen to know.
It's the same with our coping group. Sometimes we think, are we doing it right? Or you don't always get the feedback, you see, when people drop out. That's another thing. You need to get like that feedback if people do drop out, why they dropped out. And then obviously these results, 70% and things like that, they're great, aren't they? And you get all these results, but that's the only thing. It's that drawback, isn't it? Always thinking, are they not going because of the internet rather than
Yeah, and certainly
content.
our plans would be to ask anyone who left why they left,
Yeah.
and the plan would be to try and interview them about what put them off or what caused the problems. Yeah. Has anyone else got anything kind of around the tech aspect of it? Okay, so I suppose another question that
Joe, sorry, just I shouldn't keep butting in, but you know me.
Yeah.
I'd be interested in what colleagues think about the availability of alternative dietary choices during the pandemic, and whether people think there are barriers or things that we could do to help people if they're thinking about how they change what they eat, and how they might cope with a low carb diet to move to what's potentially more expensive diet or an unfamiliar diet, or whether they think the pandemic might make that easier or harder.
anyone had any experience of that?
Obviously not, so I wish I hadn't asked it now.
Yeah, it's a bad question, Mark.
Yeah.
There is
No.
around, like food banks, people using food banks, and availability of getting to shops, or whether people are getting like food deliveries and stuff, or whether they're going to local shops and then they might have their food choices affected by where they can get to.
Exactly.
Yeah, fresh food, isn't it? Fresh fruit and veg, things like that. You know, we take it. A lot of people can take it for granted, but some people may not have access to it.
Yeah, I mean, I think if you're relying on food banks, it's going to be very difficult to tailor what you're eating.
Well, exactly.
Unless you
run your own food bank.
Yeah.
Which is something worth thinking about, though.
Very odd things in them. Like I went to one with somebody and they had like pheasant and all sorts of food. I don't know why, but.
Yeah, it depends who's dropping in.
If you live on the Queen's estate, Selena, you know.
Yeah, bit of roadkill. I nearly hit a pheasant yesterday, by the way. But no, it's again, it's if it's low income families, is it attainable to get to to change your diet?
Yeah,
isn't it?
So the trainers are fervent that it doesn't necessarily change your income, change the amount that you have to spend, and there's they've got a lot of strategies of how to do it on a budget, but I think part of that is I think that's fine to do once you've got people to attend. It's getting that message out that it doesn't look like a middle class thing to do, which I think I'm working on in terms of engaging with community groups in Toxteth and Central Liverpool more widely to try and advertise that that's not what we're doing. But I suppose it's also how much people are engaging with those community groups during COVID, and obviously some people will still be needing it hugely, but I wonder whether there's a large group of people who are not doing, and we're trying to get the message out. I don't know if anyone's done any recruitment during COVID.
Naheed, are you on the call? You've done quite a lot of work with community groups, haven't you?
Yeah, it's ongoing. I've not really had any problems recruiting anyone or anything, because we've just got a WhatsApp group, and we're on Facebook, and we're in quite a close-knit community with a lot of elderly who need help and actually do ask for help as well.
Yeah.
The diet thing, I do understand. I think there was a pitch about the diabetes and carbs. My daughter's recently been diagnosed with diabetes within the last 12 months, and actually it's got worse over lockdown due to it's cold as well, but obviously because she's got learning disabilities, it's that lack of understanding, and it's I think carbs is an easy to reach food as well.
Is that type 2, Naheed? Type 2 diabetes?
Yeah, it's type 2. I mean, we're quite shocked because we're quite careful, but it's gone worse over lockdown.
Yeah.
Be very interested in that.
I mean, it's interesting that you're saying about being quite careful and that like taking responsibility for it, and it's not necessarily.
Yeah, we're quite health conscious, and we do try to be very, very careful. But obviously, I think it's a case of knowing as well exactly what the carbs are and what they're in. You don't realise how many things there are carbs in. Yeah.
And that's part of the program. But I suppose, like, how would it need to be advertised for you to get involved in that, or do you think
you might need to take this offline, because I think we're just going to go back into the main room now.
Everybody, the link in the chat.
Thank you very much for everyone's participation. That was really helpful.
You need to do a quick summary in a minute as well, Joe.
Here now, or back in the main room?
Hall, main room.
Okay.
Are we all going back to the main room now, automatically?
Oh no, sorry, Naheed, the link's in the chat to get back into the main room. Kathy is still there.
Me?
Yeah.
Yeah, I'm still here.
Are you not going back into the main session?
Oh, I thought this was the main session.
No, sorry, the link's in the chat. Sorry.
Oh, okay. Sorry.
Sorry, I didn't know whether you're away from your computer. I was waiting for you to come back.
Hang on, wait. You're just waiting for stragglers, are you?
Yeah, I'm just waiting to make sure everyone goes.